long-awaited review into NHS gender services for children has warned teenagers are falling off a cliff edge when it comes to care. The Cass Review's final report says children have been let down by a lack of research and evidence on medical interventions in gender care in a debate it describes as exceptionally toxic. Prime Minister Rishi Sunak has welcomed the review, saying the well-being and health of children must come first. The report recommends there should be extreme caution when prescribing hormones to under 18s. Families and carers, it says, should receive clinical guidance when making decisions about the social transition of children before they hit puberty. It also calls for follow-through services for 17 to 25-year-olds, including holistic and therapeutic support. And every child seen by NHS Gender Services should be included in a full programme of research looking at characteristics, interventions and outcomes. Well, Inquiry Chair Dr Hilary Cass says point scoring is preventing open discussion about the issue.
It's frustrating when the debate is so toxic and you feel that there are some really important societal issues that mainly impact adults, and children are caught up in this, and the point scoring that's going on it just means that we can't talk openly about what the right thing for them is, and so that's been really, really frustrating. Having said that, it's still been, if people ask me would I do this again, the answer is yes, because I've become more and more passionate as time has gone on about wanting to see things change for this group of young people.
Well, Sky's Mollie Malone joins me now to discuss this further. Mollie, does this include a lot of recommendations for changes, or have some changes already taken place? What's likely to happen next?
Yeah, 32 recommendations in total. This is a thorough, long-awaited review. It's been worked on by Dr Hilary Cass for a number of years now, and she really does offer quite a critical perspective of the state of gender identity services for children of the past, and I think really offers quite a cautious and careful approach to how she thinks children presenting to gender identity services should be treated and cared for in the future. She made, as you said, a number of recommendations, one on hormones used, of course, as a medical intervention to delay the onset of puberty. And she said there should be an extremely cautious clinical approach. A strong clinical rationale needs to be there if they're going to be given to children before the age of 18. That is in keeping with NHS England's current perspective on using hormones. But that sort of approach was replicated across her recommendations, really. She talked of needing holistic care when it comes to treating children in gender identity services. And she specifically said that that could include screening for neurodevelopmental conditions and mental health assessments, for example. She said it's important that children are cared for in a holistic manner. She also said the NHS should establish better follow-through services for 17 to 25-year-olds, alluding there really to trying to bridge the gap between children and adults when they transition from a child waiting list to an adult waiting list. Many children at the moment finding themselves waiting a number of years on the child waiting list and then becoming an adult and then finding themselves on the adult waiting list. She also devoted quite a lot of time to this idea of social transitioning, which is when children start to use different names or pronouns, and she intimated really that it's not a neutral act, if you like. She said that before in her interim report, but she said this idea of kind of heading down at using a different name, using a different pronoun, often ends up, the earlier you do that, you end up heading down a medical pathway. And it's that language actually that some in the trans community have taken issue with, because they say that presents a sort of anti-trans rhetoric, if you like. Mermaids have responded, the trans charity have responded to Hilary Cass's report today, and they said, we are pleased the voices and experiences of trans young people appear to have been heard and respected, and we welcome Dr Cass's calls for trans children and young people and their families to be treated with compassion and respect. However, they go on to say, we are concerned that some of the language in the report is open to misinterpretation and could be used to justify additional barriers to accessing care for some trans young people in the same way the interim report has been. Now, in terms of the politics, Labour have said if they were in government, they would accept those 32 recommendations recommendations. The government have said they need time to digest what is a very comprehensive report, and I think that will be the case for so many, with so many different views on what Dr Hilary Cass herself said is a highly toxic debate.